EP study is short form for electrophysiology study. It is done to assess the electrical system of the heart. We know that angiogram is done to assess the blood supply of the heart. Can be compared between plumbing and electrical wiring. So while tubes are used as catheters for angiography, wires are used as electrode catheters for EP study. This is an X-ray image intensifier X-ray image showing multiple catheters within the heart for an electrophysiology study, and you have some surface electrodes also here. When you take an X-ray, both will come in the same picture, even though they are at different planes. These electrophysiology catheters are within the heart, while these are on the surface of the body. Electrical system of the heart is also known as conduction system. This is a simplified diagram of 4 chambers of the heart. Left atrium, upper chamber, right atrium, right upper chamber, right ventricle, right lower muscular chamber, left ventricle, left lower muscular chamber, which is the thickest chamber, and the diagram of conduction system. The signals in the heart, spontaneous signals for heartbeat, originate in the sinus node in the upper part of right atrium, and from there it is conducted to the AV node. There are 3 pathways between these two which are small and has not been shown here. And from the AV node, the signals pass through the bundle of His, that is passing through the junction between the atria and the ventricle. There is something known as fibrous skeleton of the heart, which insulates the upper chambers from the lower chambers. This His bundle penetrates the fibrous skeleton of the heart and reaches the interventricular septum. And in the interventricular septum, that is between the two ventricles, the wall between the two ventricles, it divides into two. A right bundle branch for the right ventricle and a left bundle branch for the left ventricle. And there are also divisions for the left bundle branch which are not shown here. And finally, tiny branches reach the heart muscle. Only a few of them have been shown for simplicity. They are known as Purkinje fibers, and they reach each and every heart muscle cell. So once the signal comes from here, it reaches here, and after a short delay, it is known as AV delay, it goes down and then reaches all of the ventricle. So the upper chambers contracts first. After a short delay of about 1/5 of a second or less than that, the lower chambers contract. The delay is useful for good filling of the lower chambers before they start contract. The blood from the upper chambers should empty well into the lower chambers, and then the lower chambers contract, ejecting the blood from right ventricle to pulmonary artery to reach the lungs, and from left ventricle to aorta, branches of which take blood to whole body. So this conduction system is needed for organized contraction of the heart. Usually 60 to 100 per minute. That is a normal heart rate. Heart rate below that is known as bradycardia, and heart rate above 100 is known as tachycardia or fast rate. We are going to study these abnormalities in heart rhythm and conduction by electrophysiology study. Electrophysiology study will tell you whether the conduction from these in this sequence is correct or there is a block of conduction somewhere, and whether there are abnormal focus originating. Instead of the sinus node, sometimes focus can originate from the ventricle. Sinus node may be slow and abnormal focus can originate from ventricle. Then it is known as ventricular tachycardia, which is a dangerous condition. All these can be assessed by electrophysiology study. Conduction abnormalities and heart rhythm abnormalities. Fast rhythm and slow rhythm. The first test to assess the electrical system of the heart is not an EP study but a simple ECG, that is surface ECG, recorded from the surface of the body. This is a 125-year-old test and widely available, almost inexpensive. For the ECG, electrodes are placed on the limbs, on both hands and both legs. 1, 2 and 3. These are 3 electrodes which are active, while electrode on the right foot is inactive. It's an indifferent electrode for comparison. Then this is a central connector. There are 6 electrodes usually placed over the chest. They are known as V1 to V6. Sometimes in special cases, right-sided chest leads can be placed, and there are other leads also which could be recorded if needed. Usually 12 leads are recorded. That's why it is known as 12 lead ECG. That will have different combinations of the electrodes. Electrodes are not leads. When 2 electrodes are connected together in the machine and the recording taken, that becomes a lead. This is a diagrammatic representation of electrode catheters being introduced into the heart. Here it is from the lower side. That means the electrodes are introduced from the groin. It could also be introduced from above, that is through the veins of the neck. Here this electrode catheter has 2 electrodes, one at the tip and one just before that. Similarly, here also there are 2 electrodes at tip and just before that. But that's a highly simplified representation. Usually there are many electrodes, which we will come to soon. This is another catheter in the ventricle. This is in the upper part near the sinus node. This is now near the AV node, and this one is in the right ventricle. This is a screenshot from image intensifier X-ray of electrophysiology catheters. Always there are surface electrodes also. These are surface ECG electrodes seen in the same image. And this is a quadripolar catheter in the right ventricle. Quadri means 4 poles you can see. And this is a decapolar catheter in the coronary sinus. You can see 10 poles, but it is not clear in this image because that's a deeper structure here. And this is another quadripolar catheter at the His bundle, 4 electrodes. Here is a sample EP recording, multi-channel electrophysiology recording with electrodes within the heart and outside. These 3 are surface ECG. You can see that the complexes are spaced more because the sweep speed is more. Typically it's recorded at 200 millimeter per second, while surface ECG standard is 25 millimeter per second. You can see a sample of surface ECG here. These are the 3 leads shown. You can see that this is narrow QRS complex while this is wide because the sweep speed is much faster to see finer details of intracardiac recording. And just as surface ECG has multiple lead combinations, there are other combinations here also. This is His distal, means His bundle recording at the tip. This is proximal, just before that. And this is electrodes 9, 10, 7, 8. This is from the coronary sinus. CS means coronary sinus. 5, 6, 3, 4, 1, 2. This is RVD, means at the tip electrode in the right ventricle. RVP is proximal, that is just before that. Then this is the mapping electrode, that is also the ablation catheter. Distal, proximal. There are 2 electrodes shown there. So different recordings are taken, and from this you know how the sequence of conduction is occurring within the heart. That is electrophysiology study. This is a diagrammatic representation of another device used in the electrophysiology lab known as programmed stimulator. Initially, the normal conduction sequence of the heart is assessed. After that, signals are given artificially from this programmed stimulator into various points of the heart, and the conduction sequence, change in conduction sequence, is assessed. It also tries to see whether the abnormal rhythm which occurs spontaneously can be reproduced exactly in the electrophysiology lab, because when the test is being done, abnormal rhythm may not be there. This can check whether the abnormal rhythm can be produced in the electrophysiology laboratory and whether it corresponds exactly to what occurs spontaneously. And then you know the focus of origin, which can be ablated by radio frequency catheter ablation.